Okay, so this is part 2 of my nursing video number 1, and I was told to pan around the room a little bit, so I'm going to show you all my junk that I have here. And I'm panning around the room, panning around the room, panning around the room. Say hello. Hi. All right. Alright, and now I'm going to put this down and come around. Let's see. Alright. Okay, so this is part 2 of Nursing 1 video. In the first part, I went and I've covered, it was section 1 and then part of section 3, which was the neck, so that's where I stopped. So today what we'll do is we'll go ahead and cover eyes and ears and nose and mouth. So that's what we'll do with this video. I have all my stuff in front of me, so you'll see me reach down and I'll be pulling my stuff out of here. Let me get everything out of the way. Okay. Alright, so we're going to go ahead and we're going to start. Now the first thing that, according to the rubric, what it said to do was to describe the Snellen and the Rosenbaum test. And those, normally we have new customers that come in, new clients. When they come in, we go ahead and we do a Snelling, and we have them stand about 20 feet away from the chart, and the chart has different gradients of letters, so as you get down farther on the chart, they become smaller, and they'll have like 20, 20, 20, 20, 30, and what you do is you have them, if they have glasses on, you have them do the test first, and then they cover each one of their eyes. You do that one set and then the other, and you stop where they can read the lowest line, and then you're going to compare that to without the glasses. And the lowest line that they can reach, say it's 20/30, it means that they can read at 30 feet what somebody can read at 20 feet. And that would be the Snelling test. The next test would be the Rosenbaum test, and normally what they do is you would have something like, say, a paper, and you have them cover one eye, and this is for close-up, so you would have them cover one eye, and they would go ahead and they would read on the paper and see how far they can get down the paper into what line, the smallest line that they can read. And then they cover the other eye and they do the same thing. Normal vision for this test would be like 14/14. And that would be the Snellen and the Rosenbaum. The next thing that we will do is I'm going to have my patient come a little bit closer here. So the first thing I would do is go ahead and inspect and just look at her and see how she looks. So right now, I'm looking, and her eyes seem they're equal on both sides. There's no sign of ptosis, no drooping. She's got, let's see, I'm going to take a look at her corneas. And so we're just looking for the color right now, and they are clear. So her corneas are clear. Her the sclera of her eyes are white. She's got equal distribution of her eyelashes on both eyes. Her eyebrows are equal on both sides. There's no ptosis, no drooping. The next thing that we're going to do is we're going to go through a few different eye tests. The first thing I'm going to do, though, is I am going to measure the size of her pupil, and I do have a pupil gauge. I don't know if you need to see that, but I do have a pupil gauge. So we're going to kind of gauge her pupils right now. She is at a 5. So she's at a 5 bilaterally, both eyes. The first thing I'm going to do is I'm going to have let's see, I'm going to have you cover one eye, so go ahead and cover one eye, and I'm going to go ahead and cover the opposite eye, and then what I'm going to do is as soon as you see movement, I want you to let me know. So we're going to do like a little bunny here. So as soon as you see a movement,
Yes. Yes.
and this is going to test
Yes.
the peripheral. Okay, now let's cover the other eye.
Yes. Yes. Yes.
Okay, so that test just lets us know if there's any kind of peripheral problems with the sides. The next thing I want to do is I want to check the reflexes, so I'm going to shine a light in one eye and check for a consensual response in the other eye. So, and there is constriction of the other pupil, so. Same thing with the other one. There is constriction in the pupils, and then we're just going to go ahead and just check for the clarity. And you got that little sparkle going on. Okay. Next thing we're going to do is we're going to check the different fields of gaze. So we're going to, what I want you to do is focus on my nose, and then just follow with your eyes. So we're going to go out, up, down, up, crossed, up, and down. Very good. So that checks 3, 4, and 5 as far as her gaze, and that was good. Her eyes moved, and there was no problem. They moved, and they were smooth movements, no jerking. We'll do the cover and uncover test now, and we'll check to see if there's any kind of like a lazy eye. So I'm going to have you cover one eye and focus on my nose. Okay. Now go ahead and uncover it. Okay. And I see no movement. There's no turning in or turning outward of that eye. And go ahead and do the other one. Okay. The same thing. So both of her eyes are fine. They're not turning in or turning out with that focusing, refocusing. So the other thing I want to do is let me get you to focus on this TV that's up here. Okay, and then what I'm going to do is I'm going to go ahead and put this in front of your eyes, and then I want you to focus on this. Okay, so focus up here first, and then go ahead and focus on that. Okay, and her eyes go ahead and they do constrict because they are accommodating for what the near vision is now, and that would be the accommodation. The next thing I'm going to do is I'm going to have you rotate your chair around, and we're going to do a whisper test. A whisper test. And what I'm going to do is have you close your eyes, and I'm going to whisper something in your ear, and I want you to repeat that phrase back to me. Okay?
The sun is rising.
It's raining.
I can't really hear it.
Okay. It's raining.
It's raining.
Okay. All right. So that is the whisper test. Oops. I'll have you spin around again. Okay. So the next thing that we're going to do is we're going to do the Weber test. And let's see. Well, first let's look in her eyes, and then we'll move on to the rest of the acoustic test. So, because I want to make sure I have that red reflex. So we're going to go ahead, and I'm going to start this on 0. Let's see. Okay. So right now we're looking for a red reflex. So I'm going to go ahead and focus in. Doesn't seem like it's bright enough. Let's see if we could change it a little bit more. kind of hard in this light. No, I can see it. Okay. So that, the red reflex is present. Let's go back. Now, next thing we're going to do is I'm going to go ahead and look in, and I'm going to kind of look at your eye and look behind your eye. So you're going to feel my hand on your head. Let's see. I'm going to focus in. And I definitely see the red reflex. I see the veins. I see the macula. There's pink. And I definitely see the fillet. Let's see. I see the optic disc too. Yeah. Okay, so we have the macula is pink. I see optic disc, and I see definition of the different veins and arteries. That one looks good. Okay, I'm gonna do the other one now. Same thing. Nice red reflex. Macula is red, pink. I definitely see a optic disc, and definitely veins and arteries. It looks good. They're bilaterally the same. That's very good. All right. So the next thing I want to finish up on is the acoustic tests. Okay, so we're going to do the Weber first, and the Weber is going to be put down in the middle of your head. So I'm going to go ahead and we're going to make sure you can hear that.
Yep.
Okay. And now the Rhine, and this is going to check the conduction, the bone conduction, and then the hearing in the front, the air conduction. So let me know
Yep.
when it stops.
When it stops.
Mm-hmm.
Stop.
Can you hear it?
Mm-hmm.
You know it stops.
No, I don't hear.
Okay. So that's one ear. You know it stops.
Okay.
You hear it?
Mm-hmm.
You know it stops.
Okay.
Okay. So the air conduction is longer than the bone conduction, and that's the way it's supposed to be for that. The next thing we'll do is, let's see, let me grab some gloves, because I did not palpitate your lacrimal gland, and I want to make sure I don't miss that. So I hate to backtrack, but I am going to go ahead and do that while I remember. So the lacrimal glands on the inside, there's no pus, there's no I don't feel anything unusual. They look within normal limits on both sides. And as far as the oracles look even on both sides. They're midline to the middle of where they're supposed to be here. The eyebrow lined up with the pinna. The exterior meatus is within normal limits on both. There's no sign of infection. There's no trophy. None of that is present there. So, as far as the mastoid goes, do you have any pain
No.
in the back? Okay. So she has no pain in the mastoid bone, and we're going to go ahead and just take a look at her tympanic membrane. Okay. This one is flat and gray. I see a shadow of the bones, and I see a light reflex on that one, so that one looks good. This one here. Is also flat and gray. It looks like there may be some little bit of scar tissue in this one, but I can still see shadow of the bones. They're both equal bilateral. Because the next thing we're going to do is, well, you know what, I'll leave this light on. Let's go ahead and look at, we're going to look at her nose. So as far as I can see her nose, it is midline to her face. I don't see any type of scarring on the outside. Everything's intact. Let's see. It's pink. The septum is straight and even. The nose is moist, inside is moist. So I see no problems with that. What we're going to do is we're going to test her smell. So the first thing I need you to do is go ahead and close your eyes and then occlude one nair. And I'm going to have you breathe it in and see what you think. You ready? I'm going to waft. What do you think? You smell it?
Minty.
Mm-hmm. It's her olfactory. Okay, now close your eyes and do the other one. Hopefully you can smell this after a minute.
Coffee.
Yep. Okay. So she has identified both scents. Next thing we're going to do is give her a tissue. And what I want you to do is cover one of your nares and then just breathe out of the other one, because we're going to see if it'll move. So
Okay,
cover
do
one.
that.
Yeah. So we want to, okay, that's good. And then let's do the other one. So we're looking for movement on the tissue, making sure that there's no blockages in her nasal passages. And I didn't see any signs of polyps, so we're good with that. The next thing that we want to do is I'm going to go ahead and look in her mouth. And so I'm going to get you to open up. I know, we have coffee, Beth. That's why she's laughing. Okay, stick your tongue out. All right, so let's see. This room has a lot of shadows in it, so I'm going to go ahead and... all right, say ah. Okay, her uvula moves up and down when she says ah. Go ahead and stick your tongue all the way out. Can you move your tongue side to side? Okay. Can you put your tongue in your cheek? Above the side. Okay, good. So now what we're going to do is I'm just going to look at your teeth. So, ah. Okay. She's had some dental work. And then also I'm going to just take a look, and we're looking at the glands and the sides and your gums. And they look healthy. They're pink. Your mouth is moist. The gums look good. Lift your tongue up for a second. Her frenulum is intact. That looks good too. Okay, there's no sign of any type of lesions in her mouth, not on the outside of her mouth. There's no, her mouth is symmetrical. Her nose and her mouth are symmetrical to her face. Both sides look the same. There's no signs of ptosis or drooping. She has no signs of any kind of like lesions, like herpes or any kind of thing like that, which is good. I'm glad she's happy about that. I did not count her teeth, but if I wanted to, I could count her teeth and make sure how many teeth she has. But she has had some dental work. Looks like she's had quite a bit. Got a lot done. And that concludes our exam. So just want to thank you. And if you have any questions, let me know. All right.